A local branch of the Canadian Mental Health Association is looking for donations. They've started a fundraising campaign with a goal of $1 million. They say they need it because of the toll the pandemic is having on mental health in this region, including an increase in suicidal behavior. Claudia Den-Boer is the CEO of the CMHA's local branch, and she joins us now. Good morning.
Good morning, Tony.
Tell me about that increase in suicidal behavior. What are you seeing?
Well, unfortunately, the pandemic has impacted so many in a negative way. I think the degree of isolation, the restrictions, the challenges with school closures and the pressures that that's putting on families. People are just having a hard time coping, and some are losing hope. And so we have seen about a 25% increase in individuals identifying that they've contemplated taking their own life.
You say about a 25% increase. I wonder about the accuracy of the data. Do you think there's more going on than you really know about?
I suspect that there is, because sadly, there's still a considerable amount of stigma attached to talking about the challenges we might be having with our mental well-being. And it is difficult to capture this data. Sadly, again, individuals are often alone when they're making these choices. So this data is based on the conversations that we are having through our programs and services and with individuals who are reaching out.
How many people act on their suicidal thoughts?
Well, again, I think that's the challenge with capturing this data. I know last week our staff were aware of at least 4, and that's in 1 week. So it's just a very, very sad statistic, and something that we really believe that prevention and promotion can make a difference. If we can get to these situations earlier, we can maybe mitigate it moving into something more serious. And the research would support that.
In addition to suicidal behavior, what other serious mental health issues have increased during the pandemic?
Well, we know that we have seen an increase in substance use. Our colleagues at Windsor Regional have seen that. Our first responders, we actually had a group of mental health and addiction providers meeting last week from across the region, and this has been their experience, and it's certainly that the data is bearing this out across the province.
Why do you need an extra $1 million?
Well, unfortunately, at this point, we are not funded to provide prevention and promotion activities. And we launched, actually, in 2017. Hard to believe it's been 3 years. We launched our Soul Focus project with a specific focus on awareness, education, and training, again, because of our commitment to the well-being of our community. And we had a tremendous response to that campaign, and we have, as a result, been able to put a lot of people on the ground, boots on the ground, if you will, to help support, I would say, of late, through our On the Front Lines campaign. We've been supporting workplaces. Employers are really committed to taking care of the staff that work for them. And we've had a tremendous number of people reach out asking for support. So given the increased demand of the pandemic, and we anticipate that the demand will increase even more as we start to come out of the pandemic, hopefully with the advent of the vaccine, that the demand will increase even more. So we really are looking forward to being able to bring a number of more people to come and serve and deliver programs at workplaces, whether it's programs for first responders, for small businesses, entrepreneurs who have been, certainly hard hit from an economic perspective. So that's how we're hoping to utilize the money. A little bit of marketing, but mostly boots on the ground to try and support individuals where they're at.
And what evidence do you have that using resources like that really works?
Well, we've been surveying every time that we deliver a program. We have surveyed, and we're hearing directly from individuals and of late from employers that they feel that we are providing the awareness of when one's mental well-being is deteriorating. What are the signs and symptoms? How to assist if someone is having suicidal thoughts. We run a program called Assist, and we hear regularly the difference that is making in people's awareness, as well as having being better equipped to support someone who may be sharing that kind of information.
If this sort of outreach is so critical to what you do, why isn't it funded by the government?
Well, I think you've touched on it. Prevention and promotion activity, it's hard to measure. It's hard to measure the outcome. Surveys is probably the best way, but it's difficult to demonstrate the value proposition. So I think that's been one of the biggest barriers. But I really do believe, and sadly the pandemic perhaps has been our friend in this regard. I think it's become extremely clear how important this work is, and I have no doubt that in time this will become an area of the work that is funded. It's a continuum, and frankly, if we can do more early, if people can speak up and reach out, then I think we can actually make a difference and hopefully avoid people seeing their mental well-being deteriorate.
We have heard anecdotally of people in need of mental health support who say they cannot find it. Do we need more clinics, more mental health professionals to treat people who are suffering right now?
Well, I do think we need more people. I do think we've been historically, as a country, underfunded as compared to others in the world. But I also think you've touched on an important point, and that is system navigation. And we hear regularly from people that it's hard to know how to get to the service. So that's another area that we are going to be focusing on this year and looking at working with our partners to provide a more coordinated access, a single point where one could call or one could send a referral. And that way you make one call and you give us some information in terms of what your challenges might be, and then we can actually help to navigate the system.
Thank you so much for your time this morning.
Thank you, Tony. Have a great day.
Yes, you too. That is Claudia Den-Boer, the CEO of the Windsor-Essex County branch of the Canadian Mental Health Association.